Ready?
All right. So I am interviewing Dr. George Nomikos. Is that how you say your first?
That's correct. That's
Okay.
very good.
Thank you. For my 20% project. So my first question is, what do you currently focus on in your work? Like, what have you done in CNS at in the past?
Right. So we'll start from what I'm doing now. So what I'm doing now is that I am working on doing clinical trials for primarily depression. So in other words, we're trying to develop a new drug that will help people with depression. And this is actually very near and dear to my heart because of my background and my training. So, and I will try to address and answer your second question. And if you have any question, then you can ask me. My background, I'm a physician. I finished medical school in my home country, Greece. And then I left, I went to the University of British Columbia in Vancouver, in Canada, where I did my residency program in psychiatry. So I finished my training in psychiatry. And at the same time, I did a PhD in neuroscience. So after I finished my training, I actually liked to stay in the field of neuroscience, and I want to do a lot of research, specifically in depression. So my PhD thesis, my doctorate thesis, was on effects of antidepressants on some neurotransmitter systems in the brain, and we can talk a little bit more about what that's about. And from there on, I went to the academia. I stayed for many years, and I worked at the hospital and also at the university until I joined the industry several years later, the pharmaceutical industry. And I was always working in central nervous system disorders, depression, schizophrenia, and trying to develop new drugs for the treatment of these diseases. So what I'm doing now is, I would say, an extension or a follow-up of what I've been doing my whole life. And that is that's very good. I feel very comfortable working in that area because this is an area that I know very well. In the meantime, all these years I worked, as I said, also in other areas like schizophrenia, always in CNS, in central nervous system disorders, but depending on the project, I did projects in Alzheimer's, in Parkinson's disease, multiple sclerosis, chronic pain, neuropathic pain, and schizophrenia, I think I mentioned. But depression is I would say, my real expertise, let's put it like that, my specialty. So I'm glad that I'm back in a way doing something that I did very early on in my career.
Wow, that's a lot. Like, it's really sounds very like you're good at this. You have a lot of
You can call him SME, subject matter expert, or Captain Hook's right-hand man.
So my second question, you earlier you had just talked about neurotransmitters. They control a lot, and I know there are like two types of neurotransmitters. But are there more like dominant ones or like more important ones?
Yeah, it's interesting that you ask that because you can say, are some, as you put it, are some neurotransmitters better or more important than others or more abundant than others? And it is true in the brain, most neurotransmitters or the most prevalent or the those that are found the most in the brain are two types of neurotransmitters, glutamate and GABA.
What was the first one?
Glutamate
I'll help you spell.
Thanks.
and GABA. So these are almost in content, if you measure the content of the brain, they make almost 70% of all neurotransmitters in the brain. So you could say, well, I mean, they must be the most important neurotransmitters, which is true. I mean, they are very, very important because exactly they are so abundant. Okay? So, and if there is a disorder, if there is a disease in any of these two neurotransmitters, there are major consequences, health consequences. But there are also other neurotransmitter systems that are not that abundant. They're not in very high contents, but play a very important role. Very what we call they modulate. They are very specific in what they are doing. And these are also very important, and we know that if something happens to these neurotransmitter systems, they also cause serious disorders. So, for instance, one neurotransmitter that is called dopamine, it is only in 1% of neurons in the brain. So 1% is almost nothing, right? But we know very well that disturbances in that neurotransmitter system can lead to serious diseases like schizophrenia, for instance.
And dopamine is both an inhibitory and an excitatory, correct?
Yeah, that's true. It is both an inhibitory and an excitatory. That's totally true. While the other ones that we said, the GABA and glutamate, GABA is always inhibitory and glutamate is always excitatory.
Okay. With 350 million people worldwide diagnosed with the clinical depression, it's become like a really big issue. What happens to the brain during depression, like, and how do medications alter that?
Yeah, well, that's very important, and we know a few things, but I have to tell you that we do not know a lot of other things. Actually, what we don't know is more than what we know, and that's unfortunate. But that's why we're all keep doing research, and we hope that someday we will understand the disease better, and in this way we will treat the disease in a better way. So you're right. In fact, they project that by the year 2025, and these are data from the World Health Organization.
Yeah, that's where I got my 350 million.
Right. It will be the disease that will have a major impact on health worldwide, and more than any other disease, including cardiovascular disorders and even cancer, which, if you think about it, because everybody knows that, well, cardiovascular disorders, hypertension, stroke, and things like that, and also cancer they are very devastating disorders. But here we have another mental health issue that already is, and for sure it is going to be an even more prevalent and with severe consequences for the individual and for societies, and already is going into that direction. And in 10 years from now, it will be the main contributor to disability worldwide. In other words, the ability of people to function in their life, in their family, at school, at work. This will be the main, again, the disease that that contributes the most to the inability, to the lack of the ability of these people to function.